Have you recently been diagnosed with fatty liver and you're wondering if it can be cured? Well, you're in luck because today we will discuss how doctors manage fatty liver disease, more specifically non-alcoholic fatty liver disease. Welcome to another episode of Doctor Says. Before I start, I know there will be people among you who are eager to know, what if I'm drinking and have alcoholic fatty liver disease instead? Well, I'm pretty sure you know the answer to that as well. Stop drinking. So, that automatically makes non-alcoholic fatty liver disease a disease by which there is fat deposition and damage to the liver in the absence of excessive alcohol consumption. The spectrum of this disease ranges from a more benign condition, which is non-alcoholic fatty liver, NAFL, to a more severe disease at the end of the spectrum, known as non-alcoholic steatohepatitis, or NASH in short. The difference between the two is that in NAFL, there is fat deposition in your liver without causing inflammation, whereas in NASH, there is the presence of inflammation, and this can lead to scarring, also known as fibrosis or cirrhosis, and eventually liver failure and cancer. Now, for the treatment of fatty liver, the first thing to do, as mentioned before, is to abstain from alcohol, especially those of you who are heavy drinkers, defined as more than 4 drinks a day for men and more than 3 drinks a day for women.
Oh no!
And what is considered a standard drink? It's 12 ounces of beer, 8 to 9 ounces of malt liquor, 5 ounces of wine, and 1.5 ounces of spirits. We strongly suggest abstaining from consuming any alcohol altogether once you've been diagnosed with fatty liver, as studies have proven it to be associated with the progression of the disease. The next most important thing to do is to lose weight. In fact, weight loss is the primary therapy for most of our patients, and we recommend it for all who are overweight with a BMI of more than 25 or obese with a BMI of more than 30. We recommend patients to lose 5 to 7% of their body weight at a rate of 1 to 2 pounds per week through diet therapy and exercise. For patients with biopsy-proven NASH, the weight loss target is even higher, 7 to 10%. For patients with NASH or fibrosis who do not meet their weight loss target after 6 months of lifestyle interventions, bariatric surgery shows promising results, with the majority of the patients shows improvement post-operatively. Bariatric surgery is also known as gastric bypass surgery. It decreases the stomach volume and hence control the amount of food one can consume at a particular time, and hence it is very effective in reducing weight. Patients with fatty liver are also at increased risk of heart attack, especially those with risk factors like high cholesterol levels, having hypertension or diabetes. Therefore, the management includes optimization of blood pressure and blood glucose levels with medications, as well as lipid-lowering agents like statins if one has high cholesterol. For those who have biopsy-proven NASH and fibrosis but without diabetes, guidelines suggest taking vitamin E at a dose of 800 international units per day, as studies have shown that vitamin E improves inflammation of the liver. For those with NASH and having diabetes, the majority of the patients would be already on metformin. Although metformin is a very good drug for diabetes, it is found to have little effect on liver inflammation. On the other hand, 2 diabetic drugs that have shown improvement of liver inflammation in studies are pioglitazone and GLP-1 agonists, for example, liraglutide. However, you may want to discuss this with your doctor before starting on these medications, because pioglitazone has lots of other side effects, and GLP-1 agonist is, well, very expensive. 3 other medications that may improve fatty liver are atorvastatin, omega-3 fatty acids, and aspirin. All these 3 drugs have shown benefits in studies. However, more research is required to safely recommend its use as a treatment for fatty liver. For monitoring, we obtain patients' blood tests for aminotransferases, ALT and AST, every 3 to 6 months after patients have implemented lifestyle interventions to achieve and maintain their weight loss. During this monitoring, if the aminotransferases do not return to normal levels with weight loss, or worse still, if they increase, we will evaluate the patients for an alternative cause of liver disease. For those with biopsy-proven NASH, we will order a non-invasive scan, also known as FibroScan, to determine if fibrosis has taken place. If there is no fibrosis of liver during the initial scan, FibroScan is repeated every 3 to 4 years as surveillance. Once fibrosis of the liver is detected from FibroScan, a liver biopsy is required for confirmation. The aim of all the treatment here is to prevent your liver from progressing to fibrosis and cirrhosis. Why? Because cirrhosis of the liver basically means your liver is not functioning. And there are a ton of complications that will arise if you have liver cirrhosis. Not to mention, there is always a small chance for patients with liver cirrhosis to develop liver cancer in the future. So, are you eager to find out more about the science of liver cirrhosis and liver cancer? You may want to click on the link to find out now.